All right, so I wanted to talk about the Bretzel a little more. We do it a lot in the gym here, and wanted to take an anatomical look just to explain kind of why we do it the way we do it. So first, just a brief anatomy intro. So here's our lumbar spine down here. It's just our low back, and so you can see that just the way the vertebrae are constructed, they don't like to move side to side so much. So these are called facets, and they just, the way they're oriented, they don't allow for much side to side movement. But they're pretty good at forward and side bend. All right, so move up to the thoracic spine or the mid, the upper back. The way these are oriented, they have a lot more ability to go side to side. So with that background, that's kind of why the Bretzel is oriented the way it's oriented. So we'll go down to the ground here. So I'll go through the Bretzel itself first. So here we're stacked on our side. So there's a rib pull here and rotate. So most of the rotation coming from that mid back. So to see what it looks like with the skeleton, so basically this is the way your body's oriented. So I'll give Mr. Skeleton a pillow there. And so this is that top leg like that. Then as we rotate around here, so bring this a little closer. So we got this stack, so everything's facing this way, but then as we rotate and twist, you can see this is the spine, the upper spine, rotating like that. And it's all because of the way the vertebrae are oriented and taking advantage of the inherent structure of the different segments or the different regions of the spine. So the thoracic spine, the lumbar spine down here. So just a quick primer on why the Bretzel is the way it is. And so I guess I'll go through this too. So as an extreme example, if you were to just lay back here, which a lot of people do, just start the Bretzel, just kind of flop down like that, well, you're really not getting much rotation of anything. So which is why we're so insistent on stacking directly on your side, not on your back, because here, lock the lumbar spine, lock the hips in, and that allows for the thoracic spine to rotate just like that. All right, so I know I talked a lot about the Brettzel, and I'm probably going too deep on this, but just some little education on why we do what we do.